We're very excited today to have a community partner come and speak with us and engage with us around translation. As you know, your science research is important in and of itself, but really how we use it to improve the environmental health of people around us is really the most important impact that we can all hope for. And that's why we've invited today someone who is expert in the use of science to inform good public policy. Colleen McCauley is the Health Policy Director at Children First, the Greater Philadelphia region's leading child advocacy organization that influences elected officials by combining useful research, practical, solution-oriented policy recommendations with the mobilization of citizens who advance the organization's work on behalf of children. Colleen's research leads the conversation in southeastern Pennsylvania on children's access to healthcare and health insurance issues. She convened the coalition that wrote and successfully advocated for the passage of Philadelphia and Norristown's lead law that helps protect children in rental properties from being poisoned. She also facilitates a statewide effort, the PA Lead-Free Promise Project Coalition, that secured $10 million in state funds for lead remediation and successfully advocated for the passage of the PA Childhood Blood Lead Test Act. Colleen's work also focuses on researching and advocating for improved access to healthcare, particularly among families with children who are uninsured and undocumented. Colleen has also engaged in improving children's behavioral health and increasing access to oral health and vision care services. Colleen is a UPenn nursing graduate, and prior to joining Children First in 2001, she was an assistant director of the Abbotsford Community Health Center in Philadelphia, now the Family Practice and Counseling Network. Colleen also holds a master's degree in public health from Temple University. Colleen, thank you so much for joining us today, and we're really looking forward to your wisdom in this area of translation.
Well, thank you so much. I really appreciate being asked to speak with you and having this opportunity to have an exchange. And I first want to start off congratulating the new regional center on the launch, and looking forward to all the good work that's going to get done. There are several folks I already see who participate in the Pennsylvania Lead-Free Promise Project. Dr. Campbell, Women for a Healthy Environment, Karen and Lorna. And so I want to invite you all also to join me, right? So if you want to add to something, a comment, please do. So I thought what I'd do on this issue of translation is frame the conversation based on the tools we use for advocacy. Okay, so what I was thinking about today is I structured it around some of the major tools that we use for advocacy, building our coalition, putting together a legislative agenda, and then there's the data, the research, and the resources that are critical, and then the outreach and communications, and thinking, and then to discuss policy wins that we've had so far and our ongoing policy work. And I thought if structuring it this way, it might help to spark, some ideas for pilot projects and what have you. But first, what I thought we'd do is just level set just a little bit and share a little bit of data around lead paint poisoning. And, with this crowd, I'm confident that you're all aware that lead poisoning is still a significant public health problem, even though, lead was removed, prohibitive from being put in residential paint, a little more than 40 years ago. It's still a significant problem because we just got old houses. We got old houses in Southeast PA. We got old houses all across the Commonwealth, right? So this is a quick and dirty chart of the top 10 counties in the state with the highest number of kids who test positive. So, across the state, we're talking about 7,000 kids. And I don't know if anyone's been to the Farm Show Complex, near Harrisburg, and that's about the capacity of the Farm Show Complex. Every year, we're filling that thing up with babies who are exposed to lead. And with the definition of lead poisoning changing at the beginning of the year from 5 micrograms per deciliter to 3.5, the Pennsylvania Department of Health estimated that the number of kids who test positive going forward will nearly double, right? So we're seeing 7,000 in 2020. So we'll see what happens, as time goes on. So, right, you can see the top 10 counties here in the second column. You see some of the Southeast counties are in there: Philly, Delco, Montco, you can again see that our houses are old across the state. 70% were built before about the time that lead paint was finally banned. And in Pennsylvania, across this state, we're testing just about 20% of kids. So again, if we were actually testing more kids, we would see more children who come up with elevated blood lead levels. And what's particularly striking about what's going on in Pennsylvania is that the rate of children who are poisoned is 1.5 times greater than the rate of children poisoned in Flint, Michigan at the peak of that city's crisis, right? And you can see in some of these counties, like Berks County, the rate is 3 times greater than what was in Flint. And when you get down to the municipal level, we're doing some specific work in Delaware County right now. It's 6 times the level. So it's incumbent on public health folks, like me and others, for us to really step up our game to help make sure that parents, caregivers, families, healthcare providers understand that this is still an issue. In fact, today, I just came from media in Delaware County. I was doing a lunch and learn with a pediatric practice there, trying to support them to increase the number of kids that they test. So we're trying to do that good work. And specifically, again, I know this crowd is likely familiar with this, but lead paint poisoning is a social justice issue across the Commonwealth. As 4 times as many kids who are Black, 2 times as many kids who are Hispanic are poisoned than compared to white children, because children who are Black and Hispanic tend to live in homes, disproportionately live in homes that have deteriorating lead-based paint. Now, most of the kids who actually test positive in Pennsylvania at this time are white, but there's obviously this disproportionate impact. So again, just further solidifies how important this issue is to be working on. Most of the policy work that I've been engaged in over the last couple of years has been at the state level with the Lead-Free Promise Project. We formed about 2.5 years ago with some national funding from the Pritzker Foundation in Illinois. And as you can see here, we've got 3 main goals. Get lead out of houses, get all kids tested at 1 and 2, and then make sure those kids who test positive, that they get referred to early intervention for detection of any developmental delays, right? So those are our 3 main clear policy goals. Next slide, please. Okay, so we got, 2.5 years ago, we needed to stand up this coalition, right? And I wanted to share this list of coalition members with you to give you a sense of, who's participating. And so we have 62 organizations who are officially endorsing the Lead-Free Promise Project. They share the 3 goals that I just stated, and are committed to doing some kind of action to see those goals get achieved, right? We actually have close to 400 individuals as participants. And I would say that we probably have, I don't know, close to, I would say 50 or 60 individuals who are regularly participating. It is an awesome group. It's a really terrific group. And we try to be pretty intentional. We are intentionally diverse, whether it's geographically diverse, whether it is your industry, right? Whether you're a nonprofit or you're a for-profit business. We've got intentionally, again, this is a partnership with government as well. And so, if you look at the list, even, so we've got some community organizations like Aclamo in Montgomery County. And we've got a couple environmental groups, Bata and Bay Hill, for example. We've got healthcare providers, a federally qualified health center, Chest Penn Health Services. We've got, we've got municipalities. So the city of Lancaster is supporting the Erie Redevelopment Authority, right up in Erie in the western, northwestern part of the state. We've got universities, Franklin and Marshall College. We have health plans, which are key as far as, making sure that families are getting the care they need to prevent and to manage care when kids test positive. We've got associations like the Academy of Pediatrics. You might notice on the third column, we've got the Pennsylvania Sheriff's Association, which we also have. We have the sheriffs and we have the DAs. They're somewhere on here. And we're going to talk about that a little bit more, about why they're so critical. And again, I can just pause and say, there is an association for some kids who test positive for lead. There's found to be an association with kids as they grow up some kids getting involved in criminal activity, right? And so we have a partner. So on this list, you'll see Fight Crime, Invest in Kids at the top of column 2 that are invested in activities in early childhood, to support kids to get their best start in life. United Way, right? So we've got some statewide organizations, and we really have a nice cross-section in the state. We've got folks from all sectors of the state, and I see Lorna, let's see if I can see. Prevention is the key. How are the childcare organizations involved in lead promise? So that's a good question, Lorna. So we have DeVacy. We have not DeVacy. It's called Pennsylvania Association for the Education of Young Children. So they are all about early childhood. And as I look through this list, they may be the only official endorsing early childhood group. Yet we have a number of unofficial. We have a number of individuals participating in the coalition that work in early care, early childhood, that are not official endorsers. And so across these 62 organizations, we organize ourselves into 3 work groups. We've got a work group that focuses on getting more kids screened. We've got a work group that's focused on getting kids who test positive early intervention services. And then our third group we call public engagement, which is really driving the policy and the communications work. And couple of other Penn connections. So there are 2 co-chairs of these work groups. Dr. Harry Okatch, who is also a graduate of UPenn, and then Dr. Jim Martin. He is a family doc at Penn Med Lancaster General. So they're both co-chairing work groups for the Lead-Free Promise Project. Coalition building is key to moving policy. That's the first of several critical advocacy tools. Secondarily, we have to have a legislative agenda. And our work is in service really to this legislative agenda. And this big group, was able to come together and settle and find consensus on a legislative agenda, which is, no small feat. We have, anyways, I can tell you more about the process if you want to know, but so this is the agenda we have arrived on. We have a short-term and a long-term agenda. Short-term, we were looking to, for the state to put up $40 million to invest in lead remediation, getting lead out of kids' homes. In the short term, again, using the American Rescue Plan dollars, right, that have to be spent in a short amount of time. We asked for 40 million because if you combine all of the HUD, all of the federal grantees in the state of Pennsylvania that have money to get lead out of kids' houses, the total of those grants is somewhere around $40 million. So we said to the state, hey, the feds are investing $40 million. And so we were asking the state to match that, right? And then we have long-term legislative agenda items. So we would like not only to have like a startup pot of money, additional money to get lead out of kids' homes, but we'd like to have a recurring fund, right? So because unfortunately, this is going to take a while to help families with smaller incomes remove lead paint hazards. So we need a recurring fund. Secondly, for the long term, we wanted to see every child in Pennsylvania tested at ages 1 and 2, again, largely because of the condition of the housing, of the age of the housing stock, and frankly, the condition as well. Right now, it's only kids who are Medicaid and CHIP who are required to be tested at ages, tested period, and it's the test at 1 and 2. Thirdly, for those families who have more means, we are advocating for them to get a tax credit for removing the lead hazards in their home. So they can spend the money out of pocket, but then they can go ahead and get a credit at tax time for doing so. And again, it's an incentive to help improve and make safe the housing stock across the state. And then the fourth agenda item is really to work towards a more permanent solution. So we want to essentially see that that there's a lead certification requirement for rental properties and for owner-occupied properties as well. That when they go up for sale, the house would need to have a lead test, and then also when homes are being rented, the landlord would need to test on some regular interval, provide a certification to show that there are no hazards. Now, you may know that this is happening. It's happening on a small scale in Pennsylvania, right? So, folks in Pittsburgh, right, the Women's Health and Environmental Network, in the last year, were successful in passing an ordinance for rental properties. Philadelphia originally did it back in 2011. Last year, Norristown did it. And there's a few more boroughs that have, municipalities that have done it. And that's where the power lies. The power to require certification in Pennsylvania right now lies at the municipal level. What we're asking for, what our legislative agenda is for, to create a law that would give this power to the state to do this, and then for the state to require it. And I'm pleased to say that next week, it's expected that the first municipality in Delaware County will pass a similar ordinance in East Lansdowne. So in Philly, 82,000 properties have been made lead, have lead certifications. And in Norristown, where they passed their law about 11 months ago, 1,000 homes have been certified as lead safe. So it works. It works. Now we have to see results, certainly look at results as we're testing kids right? But here's our legislative agenda, and most of our activities are in service to this. Slide back. So the third critical, essential advocacy tool, of course, is right in your all's wheelhouse, right? It's research, it's data to produce resources, absolutely. And we have produced a number of resources over the last 2.5 years. This is a point at which, Jessica, I don't know if we can, whether or not we can switch to take a look at our website.
Colleen, while you're doing that, let me just interject that our website that will be available over the next couple of months will specifically link and make it easy for people, whether it's a healthcare worker or a community member, to get right to the page that has these resources on it. So we value these resources, and we're going to be advertising them on our site and linking to them.
We have created fact sheets for a number of counties, for the counties that have the top 20 counties with the highest number of children who test positive. So on the website, you can find a fact sheet for each of those counties, and a few others, frankly, where there were key legislators that we wanted them to know what the statistics were in their counties. And coming soon, we'll be loading the fact sheets will have a Spanish, will be translated into Spanish. So those Spanish translations should be available hopefully before the end of the year. They're done. They just need to be designed and loaded. So right on the resources page tab here. Okay, so here are the fact sheets. This top one is for Pennsylvania, but then, you can see them for the top 20 counties, like Delaware County. And soon there'll be, again, there'll be a Spanish version attached here too. And let's see, okay, all right. And then, so our partner, Fight Crime, Invest in Kids, they published a report about preventing childhood lead poisoning that simultaneously can help prevent future crime. And there's a number of research, and it's not quite loading correctly. You can't see the picture. There are a number of studies that the authors at Fight Crime, Invest in Kids have referenced in this report. And in fact, they will be releasing an updated version of this report in 2023. So this is a great resource as well. So again, this a great effort by healthcare providers like Dr. Carla Campbell and others for us to create, we call it the easy button, like, the Staples easy button, a resource guide for healthcare providers to manage the care of kids who do test positive. It's 10 steps. And let's see, these 10 steps that providers can walk through. We encourage healthcare providers to put the URL of this resource guide right into their electronic medical record so that they have easy access to the steps, and it's chock full of resources, right? So step one, right? Refer a family whose kids test positive to get their house tested, right? And here are all the phone numbers and all the health plans that a parent or family, that a healthcare provider can help a family call. Step two, reach out to find out if you're eligible for a free program, one of the free federally funded programs to get lead out of your house. And here's the list of all those programs and their phone numbers and their emails. So anyways, we're trying to make it really easy for providers. So that's our resource guide here. And then I want to show you, so that we've designed that for healthcare providers, but then we have a toolkit just for parents, right? So again, this is when your kid does test positive, although you can use it to find, you can also use it to find inspectors who will come in and test your property, period. If you just want to see if your property has lead hazards, even though your kid isn't hasn't been harmed. And so the deal is here's a map of the by county of Pennsylvania, and you click on Lancaster, and boom, so there's 6 steps for parents, or 10 steps for providers. Now we get 6 steps for parents for managing to help manage their child's positive diagnosis. So we walk them through how to get your house tested, how to remove the hazards, how to get connected to WIC, how to get connected to early intervention. So we're trying to make it, again, as easy as possible for healthcare providers and for parents. So I also want to tell you what's coming down the pike, right? Because again, because some of this will involve some research, or it may spur some ideas for some research. The next slide, please. So we are about to release a document. Actually, we're going to do it next week. 6 steps that municipalities can take to protect children from lead poisoning. Anywhere from, if you have remaining American Rescue Plan dollars, think about dedicating them to help defray the cost for your residents to test their homes for lead and to remove lead hazards. It's also, making sure that your code enforcers are, if you have code enforcers in your municipality who are going out to inspect properties, that on their checklist is deteriorating, flaking, chipping, dusting, lead paint, and that they're enforcing. Most municipalities in Southeast Pennsylvania, we've looked at a lot of ordinances in municipalities in Southeast PA, and most of them do have, an ordinance already that prohibits chipping and peeling paint. So what we're asking them to do is make sure that they're enforcing that ordinance. So that's coming out, and we are also, we've completed this blood lead testing guideline strategies and frequently asked questions for providers. And again, did this with our clinical coalition members took the lead in helping us complete this document for clinicians. Again, it's really to help encourage clinicians to test every child. And there are tips in here about how to make that easier, how to overcome some of the blocks that providers have and parents have for getting kids tested. Like, again, it's not going to be a surprise to you. Many primary care offices no longer have labs. So parents have to get a script to take their kid to get the test, and they don't get there for a whole variety of reasons. So that's coming soon. And we're drafting a document to help, again, encourage parents whose kids test positive to go ahead and connect with early intervention. And this document also will help give healthcare providers and social workers, like a script as well, to help encourage parents, because we've identified that as a block. Many parents don't see any. They don't see any signs and symptoms in their child. And that's the beauty of early intervention, though, right? Because they can detect a possible, any possible delay early. And then we have a work group that's putting together continuing education credit. Right now, we have a possible host for the credit for nurses, physicians and nurses. We'd like to be able to offer this to social workers as well. And I will tell you, we don't quite have this. We don't have our host nailed down. So if any of you are listening and have ideas about a host, I'd be pleased to listen to your ideas. And then certainly outreach and communications are key, right? So we're outreaching to find new coalition members, to find parents as coalition members. We're outreaching to key state legislators to get this policy done. And we're doing it by holding information sessions. You see, this is Mary Lou Yingling. She's a nurse at the York Bureau of Health. And this is our beautiful picture of our beautiful lead-free house display that we take on the road to draw attention to this issue. We have done a ton of press conferences, lots of media coverage. When you go to our website, you're going to see upwards of probably 20, 25, 30 articles that we've helped to stimulate over the last 2.5 years. Okay, to the policy wins, right? So this is a picture of Senator Lisa Baker at our press conference, urging her colleagues to vote for her bill that would call for universal testing of children in the Commonwealth at ages 1 and 2. And so I'll actually start with the second bullet here. So her bill, after about 3 to 4 years, did get passed in November, the Childhood-Led Screening Act. And originally it did call, the crux of it was called for all kids, not just kids on Medicaid or CHIP, all kids to be tested at ages 1 and 2. And I can tell you more, but I will, the short story is that the bill in the 11th hour was watered down. And the requirement, the calling for kids, all kids be tested twice, was removed. And it's instead the final version of the final version called for providers to keep doing essentially what they're doing now, is to test every kid on Medicaid and CHIP, and then assess kids who have private insurance based on their risk, and then you leave it up, have providers follow the AAP and CDC guidelines for whether or not to test. However, in the Childhood-Led Screening Act, 2 things did happen. 2 things did remain. One, it requires private insurance companies to pay for a lead screening test, right? So, if you order it for any kid, private insurance or public insurance, it will be paid for. That's awesome.
Secondly, this act calls for the Pennsylvania Department of Health to mount a lead awareness campaign, lead poisoning awareness campaign, which is stupendous. So these are 2 critical things that came out of the act. In addition, in the spring, we were able to, the coalition worked together to secure $10 million from the state legislature, the first ever investment by the legislature in getting lead out of kids' homes. If you recall, our short-term ask was $40 million. We got 10. Hey, so that's a start, right? And that money right now is being distributed by the Pennsylvania Health Department to the existing grantees, federal grantees in the state who are getting lead out of kids' homes. Thirdly, a policy win is there's an agreement, a data sharing agreement now between the Department of Health, who knows which kids have been poisoned, and the State Department that oversees the early intervention program. So it's the first step we see towards the possibility of creating an automated referral service between so that kids who test positive get referred over to early intervention. So those are the wins that we've gotten. And on the next slide, this is some of the ongoing policy work we'll be doing for the next bit of time. We want to get that recurring fund. We want a regular fund available for families who have smaller incomes to get the lead out of their homes. We're going to ask for $30 million this year. We are looking to continue to pursue getting all kids screened. I'll tell you that Senator Baker has already started taking actions to amend the act that just got passed her own act that got passed last month, to amend it so that all kids get screened at 1 or 2. The coalition is also looking into how might we also be able to get universal screening done administratively through the Department of Health. So either get it done legislatively or get it done administratively. And then lastly, again, we're looking to take that next step now that we have the data agreement between the 2 key state offices, the Department of Health and Early Intervention. Now we'd like to see a referral process set up. Now that they have the data, they know which kids have tested positive between their 2 offices. We'd like to actually see a referral service set up. So that's our ongoing policy work.
Great. Colleen, thank you so much. I have a question that I'd like to start with. One of the things that I find so impressive about your work is the very comprehensiveness of the understanding of who the audiences are, what their issues are, and the way that you bring together so many different groups, and also the steps that you take. You really glossed over some steps that I think are critical, and I'm wondering if you could maybe take one of those policy examples. I'm thinking of the lead safe certification of all rental properties. Can you just go into a little bit more detail about exactly what some of those steps were? Because I think that it's really the fact that all of those steps kind of coalesced at the same time that really made all the difference.
Dr. Howarth, you're speaking about at the municipal level.
Yes. So if we go back to, say, for instance, something that you did at the municipal, I just pulled the example. If there's another example you'd like to use, feel free. But I'm very aware of that one, and so that was just my suggestion.
Oh, sure. No, that's great. Just right, because we worked together on the Philadelphia Lead Coalition to get the lead certification law in Philadelphia strengthened in 2019. And of course, again, folks from Women for a Healthy Environment, I invite you to also share about the work that you did. But I will say that we took our learnings from getting the lead certification law passed in Philadelphia and shared it with Norristown. The code enforcement official there, unlike in Philadelphia, when we had to convince lawmakers to do this, in Norristown, it came from within. The code enforcement, the head of code enforcement there was committed to doing better protecting kids in Norristown. So we didn't have to spend a lot of time convincing the officials there. So he had that commitment. And at the same time, though, we have to educate his colleagues, right? There's a council. Every municipality has a council. So Montgomery County has also has a coalition that is has a coalition, and Children First, and I participate in that. And so a group of us, again, put together data and research, created a fact sheet, and met with the county council members to let them know about how many kids are injured, how many houses are old, just educate them on lead poisoning, listen to their questions and their concerns. Certainly Norristown is much smaller than Philadelphia, so this was the lift was not as large. So it's educating policymakers. Our coalition members came to their council meetings to do presentations as well. We had community members, we had a parent, and those are open to the public. So we're using the opportunity to educate residents of Norristown. We brought pictures of what kids' houses look like before and after. And so we testified. We didn't have to, in Norristown, we did not have to go too heavy on communications. Again, because once we did talk to the council members, frankly, they were sold. They were like, yeah, this is what we need to do, right? So we didn't, every place is different, right? You got to understand what are the levers that need to be pushed to make the change. And we didn't have to do a lot of public communications work in Norristown. The beauty in Norristown also is they took it a step further. We think Norristown is the only place in the country that requires homeowners to test their properties when they go up for sale. We haven't found any other place in the whole country that's doing that. And, again, to date, 1,000 properties have been certified as lead safe in Norristown. They are humming along.
Let me just add to one of the things you said, that what usually happens is to sort of be in compliance with the federal standard is homeowners, when they go to sell their house, they basically have to check a box. Do you know if you have lead in your house or not? And people who have not proactively tested all check no, that they don't know if there's lead. And that is in compliance with federal law, when in fact, they're checking no for homes where, they're built in 1932, and we all know that would have to have had lead paint. So there are problems with the way the current federal law is built, which is why that kind of a municipal ordinance can fill that gap. So that was a really good point.
Thank you, Marilyn. Colleen, I'm not sure if we've met, but I was very impressed by your presentation. I'm the director of the Center of Excellence in Environmental Toxicology here at Penn. And Marilyn Howarth runs our Community Engagement Corps, but she's also running the Children's Center as well. But I really thank you for your presentation and for your wonderful work. I actually had 2 comments for you. So I was unaware of the issue of the children's playgrounds with the reuse of tires, and now you say it makes perfect sense that there is a problem there. So the question is at the municipal level, how many municipalities are aware of this playground danger?
That's an excellent question. And, honestly, I don't know the answer. The Lead Free Promise Project has been so steadfastly focused on children's homes, because that is the main way that children in the region, in the state, and in the country get poisoned by the paint on the walls, on the windows, on the banisters, on the doors of their homes. And certainly it's in other places, like the soil around their homes and the playgrounds around their homes. But I honestly do not know the answer to that question.
Yeah, I mean, it's something worth looking into, I think, moving forward. You see the expansion of children's playgrounds with these artificial surfaces now, and they're being promoted because they can absorb children's falls. But, it's a risk versus benefit issue, isn't it, really? And depending on the material from which those artificial turfs are made. Anyway, my other question for you is, I noticed that in your coalition, you have the University of Pittsburgh Medical Center, and you have Lancaster General Hospital, which is part of the University of Pennsylvania Health System. But I didn't see anything there from the University of Pennsylvania Health System centrally in Philadelphia. I'm sure you've tried. So are there any barriers that we need to think about there?
And so I will actually tell you that we haven't tried to get Penn Med here in the city. And we would welcome it. Lancaster General, we went for very strongly. In fact, again, being very intentional to reach out to Lancaster General to have one of our co-chairs come from there, because a Speaker of the House, Brian Cutler, is from Lancaster County. So we needed to have strong representation from his district. He is So he was the Speaker of the House. We were very intentional about recruiting a coalition member there, and University of Pittsburgh Medical Center. I think that came along probably with our UPMC, and we have a very active leader in the American Academy of Pediatrics. Is from that system, and she was critical in getting her system to sign on. I think at the time also there was a legislator as well. So I would welcome your partnership in assigning on the health system here in Philadelphia, and any others. Everyone is helpful and welcome. we've just tried harder in different areas, given their legislative leaders.
Yeah, it was actually more of a comment about primary prevention. Some of the lead-free promise work has been secondary prevention in terms of getting kids lead screened. And some of the work has been primary prevention with the municipalities' work, passing prospective inspection laws. But a lot of that is geared toward rental properties, and it would be nice, it would be ideal one day if we could get enough money from the legislature to not only remediate homes of kids with elevated blood leads, but do it in a primary preventive way, to do it in the homes of pregnant women or, something like that before the child is born. And as you know, Colleen, there was the Lead Safe Babies program in Philly a couple of years ago. So something along those lines would be ideal if, for the future, that might be something to strive for.
Completely agree with you, Carla.
Okay, well, I think we should wrap it up since we are at 4 o'clock. I'd like to thank Colleen McCauley for her great presentation and discussion today.